this all started as part of several different organizations that were talking about reopening and making plans, and everybody was taking different. You gonna get those, John? Everybody was taking general guidance and trying to apply it to specific situations. And so I thought we should pull together some people to be able to answer those questions. And I reached out to Hank and said, can you help get the word out? And we partnered with the MTA to pull this together. So we've got what I would call the Avengers of COVID response ready to answer your questions specific to small theaters and performing arts organizations. You know, some of the Broadway has lots of resources, but that local theaters don't. And so we want to address and give solutions to you guys. I'll give Hank a chance to introduce himself. I just want to make sure I let you know this is being recorded. We will send the link to the recording out to everybody who was registered, as well as some additional resources and any links or anything that come up during the discussion. So yeah, Hank, how are you?
I am great. Thank you. Thank you for letting me be a part of this and for MTA being a part of this. My name is Hank West, and I'm president of the Metro Atlanta Theater Association, which is a nonprofit organization which advocates and supports and celebrates the local theater community here and local artists. And it reaches out to all the way out to Newton, to the Green Room, and Hickory up north to Hickory, I said Hickory, Statesville, and up to Ansonia Theater, Salisbury, and even into South Carolina, like into Rock Hill and Fort Mill. So we cover a very large area, and a lot of these awesome theaters are relatively small, with very little funding. So this has been a very tough time for them. And I'm just so happy that we had this opportunity to talk with these amazing people who are going to be part of this panel today. I mean, they're great. I've already talked to them, and they're fantastic. So, and I thank them for being here and taking their time to be a part of this. So that's it.
Perfect.
For now.
Thank you for your partnership with us. Well, you don't want to hear from either one of us. I want to introduce some of our folks. I'll start with Dr. Katie Passaretti, the Director of Infection Prevention at Atrium Health. Dr. Passaretti is a friend of the comedy community here and was named Charlatan of the Year. Is that the right title?
That is correct. One of them.
Oh, one of them. And was the first person in North Carolina to get the vaccine when it came out. So which superpower did you get?
Memory.
Okay, great. You've been a great force for getting information out and helping people understand how to respond to this since it started. So thanks for that. Can you give us just a general, like, where are we in this whole process? How are we doing? Are we getting better or worse?
Yeah, absolutely. So, we've all experienced the kind of waves that have waxed and waned over the course of the pandemic. The fortunate thing is we had the huge surge that really impacted our community, our hospitals over the winter months that came down nicely. And that in combination with the fact that vaccines got started going in our communities have been effective in kind of keeping cases much lower than they have been at prior points in the pandemic. Over the past month, 6 weeks, we saw a little bit of an increase in cases, increase in hospitalizations that are now seemingly starting to turn the corner and come down, nowhere near where we've been in the past, which I think is a huge kind of testament to the power of vaccines and whatnot. So, in a better place than we were, still very much in this pandemic, still seeing cases, still seeing the impact in patients that are hospitalized and having severe illness. As far as vaccines go, we're also at a kind of interesting point in the vaccine rollout. So, there was lots and lots of demand initially. We did very, very well at vaccinating older individuals that were most at risk. And now have the ability to offer vaccines to everyone 16 and older. And next week anticipate we'll add 12 to 15-year-old kids to that range. But what we're seeing is a drop in demand for vaccines. So we're kind of plateauing on the amount of protection we can offer our community. And that's so both of those things from my infectious disease standpoint are really important things to keep our eyes on. We're in this kind of balancing act between how much of the community we get vaccinated and what we're seeing as far as cases, especially as we start to mix more, lift restrictions, and see more potential spread. So, that's where we stand with those two measures. Still, pretty delicate time, lots going on, but way better than we've been in the past. And, I think we've turned corner on a lot of things over the past several months.
What in your mind is the next big hurdle in front of us?
Yeah, so it's all about vaccination in my mind right now. Some thought we did these mass vaccine clinics and had tens of thousands of people coming through and getting vaccinated, and that we got a lot of people vaccinated in a really short period of time, but those were all people that really were interested in, invested in getting vaccinated. So now it's really about vaccine hesitancy, educating our public about the benefit of vaccines, reassuring about the safety of the COVID vaccines, is probably the biggest hurdle we're at right now, because that takes a lot more individualized discussion, a lot more in the community, peer-to-peer discussion, reassurance, education, and that's way harder than getting 10,000 people through to get a shot in their arm that want it. So I think that's probably the biggest obstacle we have coming.
Okay, great. Thank you. I really appreciate you being here. And I sincerely appreciate you've been a great constant presence throughout all of this. We appreciate it. Dr. Passaretti also has had to sit through several improv shows, so she knows a thing or two about persistence. I'd also like to introduce Dr. Lupita Montoya. Welcome. Thank you for being here. Dr. Montoya is a member of the American Association for Aerosol Research and part of COVID Straight, an expert in kind of indoor air quality. Is that an accurate description?
Yes, that's what I've been studying for 30 years. So finally, people are gonna
finally
like I do.
Everything's coming up, Dr. Montoya. There was some recent news from the CDC, right? Regarding that, what can you tell us about that?
Well, I think one of the discussions that have been going on for quite a while is the mode of transmission that we thought were happening. And so I'm an indoor air quality and aerosol scientist. So I was telling Kale and the panelists that this is really something that I saw coming very early on because of what I will expect that will be happening during the pandemic. So it's taken a very long time for people to kind of acknowledge it, and it's been a lot of discussions in public. But I early on started to do my own outreach, going to radio, newspaper, and the local area, and the Spanish television, because this is something that it makes total sense. And so I'm hoping that we're going to do a better job educating our communities, because I think that's obviously, and Dr. Passaretti just mentioned, that we're now hitting the wall with regards to, the hesitancy for vaccine, as well as we hit and we're still dealing with, to some extent, the hesitancy with masking and the behaviors indoors. So we're gonna talk about these various things, but I'm very happy to be here, because I agree with her that a lot of it is gonna get to the level of one-on-one or one in small groups like what we're doing now. And I think that one of the best things that scientists can do is to make ourselves available, so that we can hopefully demystify the science that goes behind the recommendations. So I'm very happy to be here.
Great. We're happy to have you. A lot of the questions that came in were around air quality and things like that. So very excited to have you be a part of this. I also want to introduce Dr. Phoebe Olhava with St. Elizabeth's Medical Center. She's part of rapidtesting.org. Welcome. Hey, how are you?
Hi, how are you doing? Thanks for having me.
Good. And rapid testing obviously has been hugely important. It's been something that people have talked about within the theater community since the beginning. Some countries are doing lots of great work. What would you say about rapid testing? Where is it right now in terms of efficacy?
Well, I think it's come a very long way since the beginning of the pandemic. We are now having rapid tests available at CVS and your local pharmacy, Walgreens, where you can just go in and purchase one without a doctor's order. So that access has now improved significantly. However, I think there still is a ways to go in terms of using tests for public health. And that's what I hope to share with you today about how you can use testing to help keep your community safe. Okay,
great. Great. Well, we're so happy to have you. And a lot of the questions were around that as well. So I look forward to that. We've also got Dr. Jeremy Rossman from the University of Kent, who runs a nonprofit in Chicago called Research Aid Networks.
Oh, nice to be here.
Thank you. So I know the big thing that people are worried about now, the big question mark is the variants that are out there. So what would you want people to know about what's on the horizon or what's happening with that?
It's a really important point because we don't really know where things are going. We know what some of the risks are and what we're seeing right now, but variants have occurred from the beginning of the pandemic. Every time the virus infects somebody and replicates, it makes little mistakes, little changes. And so you get all of these new variants. So we've had these variants for a long time, but we're seeing sort of more and more of what they're calling variants of concern. These are new versions of the virus that behave a little bit differently. Maybe they spread a little bit better, or maybe they start to evade the vaccine a little bit. And so the real concern here is what's going to happen next, because we're doing a really good job with vaccination in a lot of places, but also a lot of areas where we're starting to get very good vaccine rollout, we're starting to ease other restrictions. And so we're having this reliance on vaccines, and we're not quite at the vaccine coverage yet to be able to sort of depend on them. And then we just don't know what's coming down the pipe next for these variants, because they're going to keep changing. And probably they're going to keep changing, and they're going to start evading the vaccines a little bit more each time. Now, the vaccines are still really good. They still really help against the variants that we have right now. But this is why we need to really support the vaccination efforts with a lot of other public health measures to make sure we're reducing viral replication and getting less viral evolution and less of these variants coming down. And we have to be looking at that globally. So it's a delicate point in time, and we don't know exactly where it's going to go.
Great. Well, I wish we did. I wish you would say that you knew exactly what was happening and tell us exactly what to do about it.
So do I.
Yeah. Okay. Well, that's where we are. So I'd like to invite all of our panelists to come on. There's a couple other people on the team I want to introduce. Jonah Evans is in the, he'll be monitoring the chat and will be kind of helping us with questions. So if you have questions for any of our folks, we have experts in, we have a virologist, we've got indoor air quality, we've got rapid testing, we've got medicine. So if you have any questions, please put them in the chat and we'll make sure we get to those. I also wanted to introduce Sarah Citronbaum. Sarah's been a big help in pulling everybody together here. Sarah?
I'm thrilled. I'm a huge theater nerd, by the way, always have been, always will be. And I was very excited when Kale reached out to combine my worlds of, COVID safety stuff and theater, and just, yeah, I'm really excited to be here. So I'm going to be supporting some of the panelists in that I have a bunch of backup information if people have extra questions, and we'll be sending out links afterwards with references and resources for people.
Great. And Sarah's already started to share some links in the chat. We will send those out again to everybody who registered as well. So Hank, you're plugged into the theater community here, the plan is we'll share some questions and
Sure.
kind of treat it as a jump ball so you can answer it. And if anybody wants to add on to others' answers, we'll go there. Hank, what are the things? What question is most on people's minds?
Well, I think especially with smaller theaters, and I can look at it both ways because I'm a performer as well. So there's questions about performers getting back on stage, as well as an advocate, and I'm a big fan of theater too. So I go and see a lot of theater, but there's reservations at how theaters are feeling about opening their doors during this time. And I know each state does it differently. They're giving different guidelines on what they think is best. Like Governor Cooper just opened up for North Carolina for indoor performances. They can have a number of 100 people now, still with a mask. But it has moved up. He moved up to 100 people. Outside performances can be up to 200, but they don't have to have a mask. It's not required to have a mask. This was all effective April 30th. So I think as a performer, I have concerns, but for the theaters, like I say, a lot of our theaters, there's theaters here in Charlotte too, are very small, who have very limited budgets. And I guess their concern is they're dying to have live theater again. They want it. They want to make sure they feel secure. They want to make sure their performers and their tech people are secure, and their the public, the people who come out to support them. They want them to feel secure too. And a lot of theaters have opened up, quite a few, and they are doing everything they can to keep it safe, and they've done a very good job. But I think the major concern is there's just so many unanswered questions at this point, and each state is handling it differently as well. So I'm sure any kind of advice or direction that this awesome panel can give us would be great. That's it. That's it. That's the broad strokes. Those are the broad strokes on that.
Yeah. Well, let me put a fine point on. I don't know if anybody has just general responses, but let me put a fine point on it. One of the questions was early on, temperature checks was the go-to. Like, well, we can do temperature checks. That's one thing that we can do. Now we're a year in. Do the temperature checks really matter? Does that do anything other than make us feel better?
Yeah, I can jump in and answer that part of it. So, the problem with temperature checks is measurement of temperature is imperfect. And, when you look at like kind of people out in the community that develop COVID, only about 30% of people have a fever. And if you take Tylenol, ibuprofen, your fever is down. So we've largely, it's a great visual, and it helps people feel like the place you're entering takes precautions seriously, and maybe dissuade some people just by the fact that, oh, if I get caught, I'm going to get turned away, and that's kind of embarrassing, and I don't want to do that. But as far as actually, the number of people that it picks up helps prevent from going in once they get to the door, it's actually relatively low. It's more important to screen for symptoms of COVID, the congestion, the runny nose, the loss of taste and smell. But those are also things that aren't objective. And that was the nice thing about the temperature. So, relatively low yield as a detector, potential yield as far as dissuading people from coming while ill. But more and more, like we've moved away from it recently within the healthcare setting. Schools, I think, have largely in many areas moved away from requiring temperature screening because it's just not great.
And I think I'm going to just jump in here with another option now that we do have rapid testing available, and it's much more accessible. Having the opportunity to either offer tests somehow, and we can help you specifically. I think Sarah put in our email in the chat to sort of work out the details of how you could set this up, but you can become a testing site and allow people to take tests on entrance. and get those test results back within 15 minutes. So that is an option for testing on site. And as I mentioned when we started the conversation, tests are also available at the local store. So there is a way where you could say, please go purchase a test and take a test, and we'd like to see a result of that test before we let you in. So those are two other options that are a little more specific to COVID. And when I'm talking about tests, I'm specifically talking about the rapid antigen tests that's available to be done that doesn't need to be sent to a lab. And it really, the best thing about it is it looks for a high viral load, and that high viral load can turn up when people are most infectious, and they may not have a fever, they may not have a temperature, they may feel entirely well. Essentially what we've learned over the course of this pandemic is that 50% of transmission occurs from people who are not displaying symptoms. So even if you ask people to stay home because they're unwell, people can come feeling well, but actually be transmitting virus. So that's the role that I see for rapid tests.
And are there inexpensive solutions for rapid testing for the smaller theaters, or?
So at this point in time, the lowest cost test that has an FDA EUA is can be purchased for $5 at the bulk price. But there are other testing methods that you can use that can bring that price down. Unfortunately, the ones that you purchase at the store are still, it's more like $12, $10 to $12 per test.
Okay.
And you say rapid test, normally how long is it, when do you get the result? You'd say within 10 to 15 minutes, you say, or?
Yeah, 10 to 15 minutes. And the idea of rapid test is that you do get that result in that short period of time, essentially meaning that you don't have to send it to a lab for processing. So now labs capacity is much better. So you may be able to send a test like a PCR test to a lab and get that result back in 24 hours, which is quite rapid compared to what we were seeing at the beginning of the pandemic, but it doesn't give you that on-site, in the moment result. I saw in the chat there, is it a blood test or what kind of test? The rapid antigen test that I'm talking about is the Binex Now, which is from Abbott, and it is an anterior nasal swab. So just in the front of your nose, you use essentially like a Q-tip and you swab yourself. It's self-administered. Anyone over 15 can do it. For younger kids, you might need some assistance from a grown-up.
That's great. So the other question, different than restaurants and others, in theaters, we bring in a crowd of people. We want packed houses. So as the different governments and localities are changing the restrictions, what should I keep in mind in terms of spacing? If I have a 100-seat theater, how many people can I have? How far apart should audience members be at this point?
I think that's Lupita or Katie.
Yeah, I was waiting, making sure that I was not muted, because I usually do that. So yeah, this is a good question. One of the greatest challenges of venues that are enclosed is precisely the fact that distancing is very difficult to achieve indoors, and depending on how well your ventilation or your air quality is, the distancing is really not going to happen. So in a venue, and it sounds like a lot of according to Hank, a lot of the groups that are attending today work in venues that are rather small. So the distancing part, it is not, I don't think it's going to work, especially if you're looking for bringing more people in. So consider the number of people. So that's the capacity in your venue. So the other alternative is looking at your ventilation. So my recommendation will be to take a closer look at the ventilation that you have, and then look at the number of people that you're shooting for. So again, you're in North Carolina, and throughout the country, we have all sorts of, regulations or or recommendation. So for the venues, my recommendation will be to look at what are the guidelines within your jurisdiction, your city or your county or the state, depending on how who you regulations you have to follow, and then look at your locale. So it sounded like there are venues where 100 people are okay. Okay, so let's take that example. I will have, as an indoor air quality person, I will ask the size of the venue. So how many people are going to be out of those 100 people? How close are they going to be? So let's get one piece of information off the bat. I said the distance is going to be very difficult, and indoors, the air is going to mix probably very quickly. So if there is COVID in the air, it's likely it's going to be spread around. And so we have to make sure that we can take that aerosol out, the COVID, because we're talking about transmission via aerosols. And so that's where the ventilation comes into place. So there are some guidelines as to what kind of ventilation will make sense that will be recommended, because some of the big spreaders, the super spreader events that we saw early on, were happening in indoor spaces where people were generating a lot of it, because the COVID comes from us as we speak. And unfortunately, we're talking about theater venues with, unless it's silent, people are going to be speaking and singing and shouting. And so that is where the aerosol is likely to happen, if we do not know for sure that those people are not, are not carrying the virus. So that's why you start looking at all these pieces. If you want to minimize that possibility, then let's move the air quickly, effectively. So some of the recommendations they have, based on what we've seen in the past, that you have at least 20 liters per second per person in your locale to make it safe, and preferably, if you can, more on the range of 20 to 25 liters per second per person. And so remember, this is on a per person basis. So what we're doing is basically replacing that air inside with clean air from outside. I have been speaking to other groups, like faith groups, where they also want to be back inside and they have these challenges. So some of the things to do is look at your specifics, and then we go from there. So this is where I will start. I don't want to take over the whole presentation. So I just want to give you some ideas of where to go, and then I'll be happy to follow up with this.
With the mask wearing on top of the ventilation, or the lack of ventilation, I mean, because they're still required to wear masks inside.
Yes.
So
yes. So my recommendation will be to continue to use masks, and the masking really is about preventing more of the generation. You're not going to be 100%, because the mask that people are using, unless you're using something that is truly 100% effective, you will generate the aerosols. They're very tiny, so they're going to get through. And so some of them, but you will definitely decrease the amount. And so with the whatever comes out there, now with the ventilation, you can take care of it and remove them as quickly as you can. So that way it doesn't build up.
Thank you. And I just got a clarification. The governor moved it from 100 to 200. So thank you, Chip, for that. He moved it up April 30th to a number of 200 inside. Thank you. Thank you.
And
I thought it was outside 200. Oh, sorry.
Yeah.
I was just going to say,
No.
COVID prevention is all about mitigating risk, right? You can't ever completely remove risk. So the things that, the COVID is spread best in poorly ventilated spaces, as Dr. Montoya was talking about. So whatever you can do to improve ventilation helps. It's spread more effectively by people that don't have source control, aren't wearing masks. So masks on the audience will further help that. And then spacing is another thing, especially if you're not sure between individuals. There was, largely out of kind of studies done in schools, where kids have gone back to school. If they're wearing masks, then, there's been a lot of debate about, do I need 6 feet in between? Do I need 3 feet in between? What's the right distance? And, what we're starting to learn from studies like those school studies is that if everyone is masked, decreasing that droplet aerosol that's coming out of their mouth, carrying infectious droplets, then, you can decrease that space somewhat, still kind of tend to, not put everyone shoulder to shoulder to shoulder, right? Because it's really hard to avoid aerosols in that case. So most, I think, try to keep different household parties or groups at least 3 feet apart, but with masking, with distancing, with good ventilation, all these things in vaccination, these are layer upon layer upon layer of protecting the people that are coming in your venue, protecting your, the people that are performing, those things add additional layers of protection.
If I may add just one last thing, in terms of fundamentals, what I would like people to think about, think about in a very fundamental level about sources and sinks. So sources, where is the aerosol or where the COVID coming from? So minimizing the source with the masking, whether it's from the people that are attending or the people who are presenting, that's one way. The other one is, the sinks. So the sinks, how do you remove it from the air? Ventilation is one way. There's also other technologies that are coming out about, UV radiation to render it the COVID, not viable. So there are a number of things with that. So if I can get people just thinking about those two basic things, I think that will be helpful.
Is the UV solution, or there's also antiviral foggers, is any of that at a cost that would be realistic for a small theater at this point?
So, I mean, you can kill the virus through things that, can be produced in the air. You can kill the virus through UV light, but it requires very specific circumstances. And often these products are being advertised and used in a way where it's not actually quantified how it's being used and if it's being used in a way that will actually kill the virus. So often these solutions are a little bit dangerous to be used because it gives that impression of security without that actual knowledge that in fact it's killing the virus. So these things tend to be, typically better avoided unless it's being set up by a dedicated expert that can actually do the validation and quantification at the site.
Yes. Thank you for mentioning that, because this is one of the things that I wanted to bring up. There's a lot of discussion about a number of things, but in reality, we don't know how effective they work. And some of them have been, tested under very specific circumstances, which may not apply in the public places that we're speaking of. And so I will say the things that will work the best are the ones that we're discussing.
And if I could also just build on what everyone has been talking about already here, our goal here is to break transmission chains. So what we want to do is make sure that there are no viral particles that are of enough quantity that are going to be breathed in by somebody who is susceptible to the virus. So who's susceptible to the virus? At this point in time, the people who are most susceptible are the people who are unvaccinated. So at this point, it's the people who have chosen not yet to get the vaccine. I'm hopeful that people will choose to get the vaccine, and it's children and people who are immunocompromised. So even if they get the vaccine, they don't necessarily mount an immune response that's strong enough to protect them. So if they were exposed, they could still be susceptible. So we want to make sure that those viral particles are not getting to those susceptible people. So there are many layers of protection that we can do. Masking is one of them, making sure that the virus, if anyone is shedding virus, it's staying close to them and not spreading through the air. You have all the air quality issues of the source of the virus and moving that air out, getting new air, fresh air in. And then to speak to what you invited me here for is testing. And so if you are aware that somebody is carrying that high level of virus before they enter your space, and you're able to say, look, you have a positive test, we can't let you join us tonight, please follow up with your doctor. You need to sort of set up a protocol for what would happen if somebody gets that positive result, if it happens at your theater at entrance. But that is an excellent way to just add another layer. Of course, these tests aren't perfect. It won't catch every single person who is infectious, but it will add an extra layer. So just to add that in.
Let me ask about vaccination. Let me just start with just the cast. So we got a group of 20 to 30 people that are going to be with each other on stage for 8 weeks during rehearsals. This is kind of came from Michelle Weiss, but I think it was reflecting some of the other questions. Is it the right thing to do to require a vaccine? And then is that ethical and legal to require, just talking about cast before we get into audience members, but is that the right thing to do for cast members?
You'll probably get a variety of responses on that one. I don't think there's a clear-cut answer, and it may vary by what state you're in. So I would just kind of caveat that, there's legislation that's in front of the North Carolina, that would essentially restrict businesses from mandating vaccines for employees, students, that kind of stuff. So, I think it's a rapidly evolving situation. My perspective as an infectious disease doctor in healthcare, we mandate flu vaccine every year for our employees to protect the patients because we have a highly susceptible environment. So there's certainly precedent for mandating vaccines. COVID is a little bit tricky because it's still under the emergency use authorization. So that kind of, intermediary step where it's not fully approved, but looks really, really good in the data. Pfizer last week came out and said they're applying for full approval. The timeline's not clear, but I think once full approval comes through, it makes that mandatory vaccination step a little bit easier. I've had a good number, and I'm not a lawyer, I'll just, say that up front. So definitely consult your legal representative on what's appropriate, what's not. My understanding is that you can mandate vaccines. You have to allow for religious or medical exemptions, and you have to do everything you can to accommodate that person's either religious or medical exemptions. So you can, there are, certainly concerns businesses have about doing that. You have to figure out your plan for if someone says, well, I have a religious, but I want to keep my job. You have to try to figure out, where that goes. I've heard some places are more leaning towards doing it on hiring, which I guess in the theater community, you guys are constantly kind of hiring a new group of people and whatnot. Rather, it gets a little bit trickier when someone's already employed. So, lots of nooks and crannies to explore there, and everyone's like really struggling with this conversation right now. May get easier in the coming months if we get full approval for places to mandate it, but it is still kind of it is still a little bit tricky right now.
Yeah, Dr. Montoya?
Yes, this is, I think, an opportunity to, as we are speaking to small communities, especially in the case of, your cast, these are people who know each other well. And so this is, I think, for me, an opportunity to just kind of use it as a teaching moment about protecting your community and doing things. I personally, I'm one of those people who, I do my vaccines, but I never did a flu shot until this last year. And the reason why, and I'm a scientist, so I do the ones that are required. And that one, the other one is more of because I like my immune system to be tip top. I did that when I was preparing to get pregnant. And every time that I'm going to do something, I like to just do it the natural way. So I always thought of it, if I get challenged, my system should be able to handle it. And I always manage, I'm 50 some years old, and I always manage through flu season every year. But last year was a different situation. There were discussions about protections that you could potentially get from the flu vaccine, potentially to help with COVID when we have no vaccine whatsoever. So to me, it was worth it to go and do it and drag my children with me to do it. And so this is something that I think we're evolving. So when you have your community near you, you may be more willing to do some that you may not have done before, or you may be questioning for yourself. But in terms of your community and how much you love your community, like I love my children, the idea will be I might be willing to do a little bit more. So this is the kind of conversations that I am hoping very deeply in a personal way that we start having at a national level. What does it mean to be part of our community? What things are we willing to do for our community? Is it something that we just say, or is something that we do? And, we're not generation, but we're not era where, you like and dislike with just the fingers, but the true like and dislike is on our action. So I just wanted to add this to you because I know that I went through this myself and it was a no-brainer. This is dangerous enough that it merited me doing things differently. So I just wanted to put that there.
Sorry, go ahead.
I was just going to say the vaccine question, Dr. Montoya hit on, and I'll just super quickly, but vaccines aren't just about protecting us, right? They're about protecting our peers and our community and whatnot. And we get focused, a lot of the people hesitating vaccines are like, oh, I'm young and healthy, I don't need to do that. Or, but it's not so much the individual vaccinated, it's that vaccines don't work unless a large chunk of our population is vaccinated. So I just wanted to kind of throw that in there. This is more an action of community good than it is at the individual level for many people, as Dr. Montoya was referring to.
Yeah, and I just wanted to say also that, regardless of whether you're getting into a situation where you're going to mandate vaccines or just recommend them, it's really important that there's very clear communication to the employees, to the staff, and not just communication in terms of saying, okay, here's a pamphlet, but actually being able to have a conversation about it, because people have real concerns for very legitimate causes, and knowing that they're heard and that they can talk to somebody and that they can get information about it. Because also, as you're both saying, part of this is also talking about, here are the risks of COVID versus this is the risks of the vaccine. And, in a lot of contexts right now, people are seeing lowering rates of fatalities from COVID and thinking that, okay, I'm healthy, I'm young, there's not really a risk for that. But often that neglects the risks of long COVID, that neglects the risks of long-term symptoms, and, also neglects the fact that people that are young and healthy are dying of COVID. This does still happen. So it's a matter of having that conversation. So Sarah and I have been having conversations with community groups to really talk people through, what we know, what the science says, and listen to people's concerns, and then just really explain what we know. So if anybody here on this call is thinking about doing something like that and would like support of how to talk to people about this, please reach out to us, because we'd be happy to work with you on that.
Fantastic. Great discussion. I think related to that, this is a legal question, so maybe this is not one that anybody here can answer, but it came up so often I want to ask it. What's my liability as a theater if I'm bringing in 100 people a night to see a show, or if I'm bringing in together a cast and someone gets the virus from my event? And is there anything that I should be doing, not to mitigate the transmission, but to mitigate my liability, like a sign that says, this is not on me, it's on you? Or and related to that, some people asked about separating. So maybe have a seating section like we used to do, smoking and non-smoking, right? Vaccinated and non-vaccinated seating. Is that a viable option? Sarah, you're on mute.
Yeah, just realized that. To the first one, I've been gathering some information today on the liability stuff, and the follow-up links will include some examples of that, as well as some example templates and forms and signs people can put up. It's different by state, but I've been looking for the North Carolina specific stuff today. So that is something that will be forthcoming with an answer, but not this exact second.
Okay, great. Thank you.
Oh, sorry, go ahead.
I think one other thing, or am I interrupting somebody?
No, go ahead.
Oh, not to specifically answer the liability, but part of, at least from a malpractice medical standpoint, my understanding is you're always asked, did you do everything possible to mitigate the risk? And so they will, if a suit, anybody can sue anybody for anything, but if you list off that you did everything possible, and that's what all of us have been talking about here, are all the different layers of protection. So if you institute all those layers, you can say, listen, we did everything possible. There's nothing more we could have done. And that if a suit was, brought against a theater company, maybe that could help by saying that you've done everything possible, including all these layers of protection, masking, improving your ventilation, and testing, requiring testing ahead of time.
Yeah, I was going to say the exact same thing as Dr. Olhava. As long as you have done your best to protect the people and put the protocols in place, you can't control individual behavior in there. And, that kind of meets the intent. Even if someone brought a suit against someone for like that, we're in the midst of a pandemic, and it would be nearly impossible to prove that you definitively got it while in the theater and not out in the community. So it would cause a lot of headache, but it seems very unlikely there would be significant legal repercussions unless you were like, look, I'm bringing someone infected, I'm going to have them cough all over you, things that would never, ever happen. So I think it's unlikely. There are going to be people that want to, be in the headlines and bring suits for various things, I feel like, in the coming months. So it'll be kind of a learning legal time for all of us. But I think the actual risk is relatively low if you're doing everything you can to, do the right things based on the knowledge that's available at that time.
And I just to answer the last part of your question, the separating the vaccinated from the unvaccinated, the virus doesn't stay in a section. It's going to spread. So, that's not really an effective means.
But what if there's a really big sign that says?
If it's strongly worded, maybe.
Okay, strongly worded sign. Great. Yeah, Dr. Montoya?
Yeah, I was going to mention, because one of the things that came to my mind exactly when you mentioned about like smoking and non-smoking section, when I was a graduate student, we had a little cartoon pinned outside our offices, but my advisor had, where it was a counter space where it said smoking section, non-smoking section. You have the two people sitting next to each other, and somehow the aerosol, because that's what we were studying, was kind of staying on the people who were on the smoking section when they were next to each other. And so that to tell you that that's not how physics work. So no, you can't have. So vaccination is a different thing, but the problem is not the vaccine in that sense. Is the aerosol. If it comes down, it's infectious. That's what the transmission is going to occur. So I think the testing is very important, because then you can eliminate the potential sources. So to me, that's the source. You eliminate them and have a good way, a good message regarding why that person may not be able to see that function, that event that night, and potentially doing it later. I mean, maybe issuing a voucher to return something. I mean, this is what the business people do. But I did have these conversations very early on during the pandemic, very early with nail salon people, because I already been advising the nail salon industry, and they were worried about bringing people back in. And so my advice to them was, there's ways to identify the people who may be problematic, and then keep track of them and tell them, you cannot do it. You cannot come in today, because at least if you know nail salons, you have very close contact with people. So for me, it was something very quickly that we said, we have to deal with the sources, eliminate every possible way. So I really like the idea of testing, because that way you have some proof that this is problematic for this person, and then find the right type of messages, and it should be varied, not just one message, because one may not speak to the person. It may be another way to bring it up to them how important it is that they don't come in today. So I'll leave it at that, but I think it's something to consider.
This is a question that came in from Will. If I'm a theater organization and we get direction from the government. It's inconsistent, and every situation is different. What are the metrics that I should be looking for to determine? We're deciding we're going to open in June, or we're going to open in July, or we're going to open in August. What are the things I really should be paying attention to determine if now is the right time to open back up?
I'm not the infectious disease person, so she can talk about directly, but I think rates of infection is very important.
Yeah, I mean, cases and percent of tests that are positive in our community, number of hospitalizations, and whether hospital, really it comes down to, you know, if our medical infrastructure is at risk, like volumes in the hospitals are getting to a very high level where you can't deal with the influx of patients, deaths are increasing. You know, the metrics that I look at every week are number of new cases in that 7-day period, hospitalization, average hospitalizations, whether the death rate is increasing. And then, you know, the on the positive side of things, vaccination rate in the community. Now, if vaccination rate is high in the community, then, you know, theoretically all those other metrics should be low, but those are the things that we kind of keep our eyes on a rolling basis. And unfortunately, everyone wants like a clear-cut cutoff. You know, school systems use, or in skilled nursing facilities and whatnot, like 5 to 10% of tests positive as kind of a lower range. Greater than 10% is considered high of tests positive in a given area. So it's a little hard, which, you know, people are uncomfortable with not having one clear-cut answer on when to, you know, move to the next phase, when to step up the level of opening and whatnot. And unfortunately, it's just kind of a gestalt of what's going on in the community.
Think in the last report, and someone please correct me because I can be wrong. I think it said at least 35% of those eligible for vaccinations have had at least one now in North Carolina. Does that sound right? And
I believe 50% have gotten one dose and 35% are fully vaccinated. We're right around there. And, you know, like our older, I shouldn't say, my husband tells me I shouldn't say older, but over 65 population, you know, on the order of 80+% have at least one dose, you know, are most susceptible. So that's kind of the range we're in, which is, you know, way better. Georgia, for example, not that far away. I think they're around 30% have gotten one dose and 20% have gotten both. So, you know, the fact that we're at 50 is very promising and I think good for our communities, and we're seeing that reflected in our rates, but, you know, still obviously have room to go, and our kind of uptake is going straight down right now.
Yeah, I almost wish we had an equation where we can, you know, say, if you add all of these contributions, the numbers will be smaller and smaller, so therefore it becomes safer. So this is the kind of thing, just think about the different parameters we're talking about. What is the infection rate, the vaccination rates, and whether we reach plateaus, is continue to improve, because I mean, if it continues to improve in terms of how many people are getting vaccinated, then you know that it's improving on a daily basis, as opposed to we're not getting people wanting to vaccinate anymore. So therefore you reach some sort of constant, and that's not necessarily a good thing, because we want to continually improve and minimize the risk. So when you start plateauing, that means you're not you're not decreasing that risk. It's slowing down, and that's what we don't want. That's why we continue to push to get people vaccinated. We want to push for people to continue to test, and, you know, and in addition to the things that we're doing with, you know, the ventilation and distancing and all of that. So all of these contribute in different ways, but the sum of all of them actually is more of a product, I mean, multiplication of it, that it will be more of, we want to get as high as a protection as possible. So if we can keep all of these various things in mind, just think about how quickly are we making progress on all of them.
And Barry asked about our other spaces, and others asked about this as well. So bathrooms, dressing rooms, some of the smaller spaces that our guests and performers are in. Are there some specific things that theaters should be doing to make sure that we're as safe as possible in those spaces?
So for, dressing rooms and whatnot, where you might need to get, ideally, you limit the number of people in those spaces, because it's hard to keep your mask on when you're taking clothes on and off, especially if you have a mixed vaccinated, unvaccinated population, or you're unclear kind of about where it stands. It may make sense to relook at that space, look at the ventilation and that, the same kind of general characteristics to reduce risk in that space apply as out in the theater. So do you need to increase the space so that you can, decrease risk to people in there? Is there any way to improve ventilation, vaccination, testing for the cast members might be another mitigating strategy? I don't know if Dr. Olhava has thoughts on like frequency of testing for cast or anything like that.
Yeah, so I would say that before performers come together as a group, whether they're vaccinated or not, at this point, we still are recommending to do screening testing for asymptomatic folks, just to make sure that our vaccines are working and we are keeping tabs on potential new variants that are coming. So we would recommend that essentially 72 hours ahead of time, I would get a PCR test if you have access to that, just to get that baseline to make sure that they are not carrying the virus. And then again, an entrance screen for their first day, making sure that you're not introducing infection, because what you really want to avoid is having to put people who are unvaccinated into quarantine, because obviously that would shut down the show. As you know, vaccinated people, if they are exposed to somebody who tests positive, they don't need to quarantine. But a vaccinated person who tests positive and enters into a group setting with other unvaccinated people, that test positive vaccinated person will initiate quarantine for the rest of the group. So you really want to avoid that before that initial entrance. And we are seeing more and more information that there is lower transmission risk if somebody is vaccinated. So that's good news, but it hasn't been proven at this point yet. So we'll keep, tabs on that for the future. But at this point, we would still recommend that testing. And then depending on how long, the show is in production and how long folks are interacting, I would continue to do weekly testing moving onward from that.
That's a great point, Dr. Olhava. So I want to say that again. So even if I have a fully vaccinated cast member, or even a full cast that's all vaccinated, you still recommend testing before they got together for rehearsals and performance?
Yeah, for that initial time, for sure.
Okay, great. Yeah.
I had a comment regarding, because you mentioned like dressing rooms, which are smaller enclosures. In places like that, something that could work also or assist in the control will be like upright portable filters, if they have good filtration efficiency, because they can address the source near before it gets spread into the larger space, where you will have to address it with the higher ventilation, because higher ventilation takes more energy. So the idea is, if there are places where you will expect to be more of a source, you can also try to do a more localized control. So in smaller spaces, a filter system, I do have them in my own home, is something that could potentially be helpful, because they have a sphere of influence that is, par with the size of the room. So if you have those things in those spaces, it may be aiding the HVAC system.
Okay, great. We for time, we'll wrap up here in just a few minutes. We'll take a couple more questions, but if you have any questions at all, put them in the chat and we'll do our best to get some answers offline and send them out to anybody that's registered ahead of time. So rapid fire, just taking some of the topics that I see there. If I'm outdoors and I don't have limitations, what spacing should I plan for if I'm doing an outdoors event? Is there a recommendation?
Yeah, outdoors, obviously your ventilation issues largely are out the window, right? Much lower risk of transmission in outdoor settings. So the degree of kind of precautions that you need to take tend to be lower. So, I think still the recommendation is that 3 to 6 foot range between parties where you can, if it's going to be a mixed population of unvaccinated, vaccinated, but just, recognition that risk, while not gone, is lower in that space, just by function of there's a lot more area for the droplets aerosols to disperse in, less likelihood of you inhaling a significant amount. So, certainly outdoor events, I'm personally a lot more comfortable with outdoor events than I am indoor, less kind of variables to control, and you can focus on, masking, a little bit of distancing, and making sure people who attend are healthy.
Okay, great. And is contact tracing or proof of contact tracing before a cast member or an audience member comes, is that a realistic and useful option?
I'm not completely following that question. What does it mean, proof of contact? You mean the ability to contact trace if someone turns out positive to the attendees of the event, maybe, or?
Yeah, I'll say yes, and I'll ask, I think that was David that asked that question. If you want to clarify what we're looking for is.
I mean, I'm an infectious disease doctor. I love public health. So for me, the ability to contact trace is important, right? So you can kind of track down people, make sure they get tested early, followed to make sure that you prevent spread, especially for those that are unvaccinated. So, being able to contact trace has been a hugely important part of the pandemic. So certainly, helpful to control spread in the community. So would encourage the ability to do that if I'm interpreting the question correctly.
That's from Jeff. I'm sorry, from Jeff. Yeah, I'm sorry, Dr. Montoya.
Yeah, I wanted to add a little bit because, I have children in school, and one of the things I need to do every morning when my child before it goes to school, is to fill out a questionnaire, a health questionnaire, where they ask about symptoms. And so in the venues that you guys are involved, that could be something that you could use, and that will help with the contact tracing, because if somebody says, even though they have no symptoms, or maybe they have some symptoms, so this is one more layer that you can add to your businesses to help you keep track of potential outbreaks. So these are all of them working in concert will be great. And I think they're simple. There's some of the, it takes about, now that I got good at it, I can do it on my cell phone. It takes like 1 minute. And so this is something that I really like, the idea of contact tracing, if we can do it simply.
Okay, great. I got one other question I'll close with, but before we close out, is there any just general advice you would give someone who is deciding right now? Is there, what are the most important things that they should be keeping in mind? I'll open that up for anybody.
Yeah, I mean, I think we've hit on them kind of, it comes down to these same categories time and time again, potential role for testing, assessing your space for ventilation and seeing if there's anything that can be done to improve that, masking of individuals, and encouraging vaccination. I personally think like the performing arts have a huge potential role to play in being that vaccine advocate. So, I'll put a little plug in as you reopen, that peer-to-peer kind of education, and that within both the performing arts community and, being that advocate publicly, I think has the potential to go a long way with different populations. So I'll just kind of throw that in as an additional plug for my perspective.
Yeah, that was going to be my last question from Judy Campbell. She asked, what could we do as a community performers to help address vaccine hesitancy? So,
and I think you've heard today, like I think all of us on this call are like super passionate about, protecting our communities and whatnot, and willing to serve as resources in different ways. And Sarah has a number of connections she's kind of put in here. So there's a lot of resources out there, a lot of people in the scientific community willing to help if, people are open to help and want that. So, there's resources out there, and, a lot of people that can connect you.
Great.
I wanted to just kind of give one last message in terms of that every single person who's here today, in addition to the presenters, the attendees, have a lot of opportunity to do a lot of things themselves You've learned some of the basics here from the different types of disciplines that are involved in this pandemic. But in terms of the decision making, it really is localized. So you will be making decisions. So let's say, for example, that the regulation said that you can have 100 people, but you have done the math and you have determined that, actually 100 people is not a good number for the safety of my community. So instead of being 50 or 100, you go down to 50 because that's what you feel comfortable with, and take that control. Because I think this is a great opportunity for us to understand. We don't have to necessarily do things that we're told that are safe. If we're not sure, we might be able to know better, but not to disregard. So it's not about disregarding advice in the negative way. I'm not going to do anything, but in terms of understanding the fundamentals and saying, even though I can do this much, I believe and I feel more comfortable doing this less than that. So I just want to leave that, because I think we need to feel empowered after this experience, that we do have the capacity to make good decisions for our communities.
And I think to go from there, exactly as you said, testing that, I've talked about here is a lot to identify the positive cases, but I think testing plays a very important role in providing reassurance. Yes. So the audience, your performers, will be reassured by the fact that everyone, or a subset of people, or the unvaccinated people, or whatever group of people you decide to sort of offer testing to or encourage testing, have negative results before entering your venue. That will provide a lot of reassurance. So it's not just the identifying the positive and stopping the transmission, but to get people back into theater, that will give them that sense that it's safe or safer.
Thank you. It's a great reminder with that there's safety, but there's also the perception of safety, and audiences aren't going to come back until that perception is there. Dr.
Yeah. I also just want to say is, we've talked about a lot of different precautions, a lot of different things that people can do. And I know it can often sound very overwhelming, but if you think of each precaution as like a slice of Swiss cheese, each one slice has holes in it. And if you have an over-reliance on any one slice, you're going to have problems. But the more of these slices you put together, the stronger the protection is. So these all work really nicely together. But the other component there that I think is just really important is that whatever you're doing, communication is incredibly important. Making sure that you're communicating with your staff, with your clients, why you are taking the actions that you're doing, and making sure that that is an open conversation, whether that's talking about vaccine hesitancy or talking about why testing. Making sure that communication is part of that strategy is really important.
Okay, fantastic. Yeah, that's an important reminder as well. Hank, is there anything, any final thoughts or anything that you'd want to say or ask?
I just wanted to clarify when I was talking about the 100 people, because I was a little vague on that. As he moved up to 100 inside, you still have to do the spacing and the distancing on top of that. So just like what Dr. Montoya was talking about, it may say 100, but you may not be able to do 100, and that's the case here. I just want to thank this awesome panel from all the way from Portland and Boulder and Chicago and Boston and here in Charlotte. Thank you so much for sharing so much with us here today. It's really, really important and valuable, and not just for us, but what you've done nationwide too. I said that earlier to everyone, but we appreciate all the work and effort that you've done. And we've got a lot of work we can do too.
Yeah.
So thank you.
And finally, Dr. Passaretti, with your expert opinion, what is the best improv troupe in North Carolina?
How are the Foxes? Hello.
Okay. I just want to make sure we got that on the record. Same question for everybody else. Same answer, I assume. Nod your head.
Sure.
All right. Fantastic. I really appreciate everyone who's registered and joined. We're going to send out the recorded link to everyone, as well as these links. Thank you, Sarah, for putting together. She's put a lot of great links in the chat. I will teach you one thing about Zoom. Anybody that would like to save the chat, you can go to in the chat, the little 3 dots and click that and hit save chat, and it'll save it as a document onto your computer. So you can save all the links and all the great things that come. And you can wave for Hank's picture. That's how Hank
Yeah.
does a screenshot.
That's the only way I do it. I'm so tech challenged. It's
Good.
really pathetic.
And I'll ask everybody to turn their cameras on and give a big thank you to our panel, Dr. Olhava, Dr. Passaretti, Dr. Rossman, Dr. Montoya, Sarah, Hank. We really appreciate all the work that you're doing, not just today, but really the work that you've done to shepherd us through this really uncertain time. Thank you for your time and your dedication and your knowledge. We appreciate it.
Thank you. Thank you.
Thank you
All
for
right.
having us.
Thank you.
Break a leg, do well.
Yeah, thank you. Perfect.
And in helping us forget some of these things.
Absolutely. All right. Thanks, everyone. We really appreciate it. And we'll talk again soon. Hopefully live and in person.
I can't place your face, Kale. I don't know if I've ever seen you. Have you seen
wow.
me?
Yeah, Hank. We were in a show together. Can't believe
We
you don't.
were not.
Oh my God.